to this screen share. I should be able to see as more people join, but I think we'll get started. For those that are here, welcome again. Those who are able to join us today. I felt it was important to kind of hear from Ohio Health, and as we're still continuing to move through the pandemic, and talk about some of the kind of the misconceptions that might be there in terms of how to, when to test for your employees to get them back to work, if that's, is that helpful, or kind of what are they hearing, in the field in terms of how we're moving through this. So I thought it was important to have David Dziedzicki. Did I do it?
Close.
Here today to talk to us. He's the senior account manager with Ohio Health. And then we're also joined by Dr. Glenn Williams, Employer Services Medical Director, who will be kind of trading off and talking to us today about kind of big picture, what Ohio Health is seeing, what kind of general Ohio Health updates there are, and then kind of, like I said, go back into what's happening in the testing arena in terms of COVID, or gosh, any kind of illness, I guess. But with that, I think I'll have us start with David.
Hi, everyone. So I think I know most everyone that's in the meeting today, but my name's Dave Dziedzicki. I'm the Senior Account Manager that supports the Work Health Clinic there in Marion. And I am just getting my presentation to work appropriately, but I wanted to introduce Dr. Glenn Williams. He's the Medical Director for the Ohio Health Employer Services Division. So he oversees all of our occupational medicine clinics, such as the one in Marion there. And then across Central Ohio, over into Marion and down in Athens, and then also oversees the rest of the division, including wellness, on-site clinics, occupational health, and then also fitness. So Dr. Glenn Williams, if you wanted to take a moment and kind of say a couple of things, that would be great.
Yeah, thanks, Dave. I think Dave said most of it there, but yeah, I've been with the division for about 3 years, overseeing those things. Really have helped with our COVID response, working with employers, working with our own associates, testing, getting them back to work, and have been on a number of these calls with different employers to kind of talk through COVID, talk through some things that may be easily misunderstood or not known as well. And I used to be with the urgent cares for Ohio Health. I actually helped start the one up there in Marion, which was pretty exciting. And it seems to be doing very well as well. So overall, been with Ohio Health about 20 years. Thanks for having us.
Yeah, absolutely. Matt, I'm just having a little bit of an issue here with my personal computer. Like I said, I couldn't join the WebEx from my Ohio Health laptop. So I am just working through that right now. Dr. Williams, you have the presentation, correct?
I do.
I did make Dr. Williams also a co-host, so you should be able to bring up his shared screen as well.
Dr. Williams, do you want to go ahead and share your screen with the presentation, and we'll go from there?
Sure will. Let me, shoot.
My Mac keeps telling me I have to update the iCloud or something like that, and so this little screen keeps popping up on my computer, which is not ideal for presenting, so it can never just go smoothly. Awesome.
Cool.
All right, can you see that?
Yes.
Yes, thank you.
Sure.
Well, we can just dive right in, just so we can get started and be cognizant of everyone's time. So, of course, I think everyone on the phone is aware of Ohio Health and who we are. I think sometimes there's not an awareness of kind of the reach that Ohio Health has and the amount of facilities that Ohio Health has across our system. So 12 member hospitals, 2 managed hospitals, one in Morrow County and then one in Southeast Ohio, and then a couple of affiliated Blanchard Valley Medical Center, and then again, that's Southern Ohio Medical Center, with a total of 60 outpatient locations across the state. And I believe it's 47 counties now, Dr. Williams, and counting. So
I believe so.
As you can think about, I think it's fantastic. Ohio Health has a very wide reach and across the state, but supporting those 12 hospitals throughout the pandemic has proven challenging, but it's something that we've been able to accomplish as a system. So you can go to the next slide. And really what we're talking about in terms of working together with our partners. So in 47 counties, in a lot of those counties and a lot of the places where we do have either managed hospitals or system-run hospitals, really it's the partnership with the local communities, which is why we're here today. And part of that is the great partnerships that we have with our local chamber. So specifically in Marion, I've had the chance to be part of the chamber, attending safety council meetings, manufacturer council, HR council for a couple of years now. And I think the partnership between OhioHealth and the chamber is great. And really it goes both ways. The chamber being able to provide information to the health system, and then of course OhioHealth being able to share information specifically during the pandemic with the chamber and kind of any information that needs to be blasted out to the community as well in terms of how the hospital can help support. And then of course we're always trying to increase access, right, and decrease the utilization of emergency departments. And I think we've done that in Marion with adding that urgent care there right across the street from Marion Tech. The volumes there have exploded since that facility has opened. I think they average over 50 patients a day, which is a pretty high volume of patients for an urgent care. And then, of course, that's a lower cost option for our folks in Marion, which is really important. Next slide. And so really we want to put your safety first, and we kind of have focused on that throughout this pandemic in the information that we blast out to our employer partners there in Marion. Specifically from employer services about a lot of the things that we're going to talk about today. We always want to make sure that we're putting our employer partners first and providing that information when requested. And I think Dr. Williams and I have been, and I don't know, countless calls with employers about, how to respond and keep people safe at work when it comes to COVID-19 and really what the best practices are according to the CDC guidelines, but then just taking those guidelines and actually making them appropriate for your facilities. I think that's always the difficult part, right? I think it's great that the CDC has their guidelines. We strictly follow them, but putting them into place in a practical manner has been difficult. And I think that's something that Dr. Williams and I have continued to try to help employer partners with throughout the pandemic.
All right, so as we look at testing, we knew as a system early on that testing was going to be very important for our patients and the communities we serve. And so early on, we started devising a plan to set up these, drive-through swab stations in different areas. And so as you look through these lists, it covers the majority of areas that we cover as a system. There's actually now 2 in Athens helping us serve the Ohio University population and the other folks that live there, and then a couple in Columbus, Kent, Mansfield, Marion, and Orient, and Pickerington. And those have been for patients that we see, that we refer there. It's not just a community drive up per se, but it's for the patients that we see, gives them an opportunity to feel safe, for the employees to be safe as well in swabbing, and to get the test to the lab as soon as possible. We also partner with Mount Carmel and Ohio State and the Columbus Health Department to set up testing, additional testing opportunities at the Columbus Health Department in those areas. So you want to talk briefly, about testing types, and I'm sure you all at least have some knowledge of these and what's out there, but maybe just to kind of give a refresher to talk through, as we see lots of different companies, lots of different, hospital systems and CVS, et cetera, all have different testing capabilities. And there's a lot of tests out there, not always the one we want to get or the one that lets us feel as comfortable as we can with the test result. And so let's just go through that real briefly. So we know COVID, the SARS-CoV-19 that causes the COVID illness is an RNA virus. So it's a genetic material, and so the most sensitive tests we have out there will detect that genetic material, the actual RNA virus, and actually particles of it. It doesn't actually test for the whole virus, but just particles on that virus. And there's a couple different types. So and it's also called molecular or viral testing, if you hear those words. So the PCR testing is what's done in the lab, and basically they take a swab, usually of the nose, back of the throat, either through the nose or through the mouth. And then it's sent to the lab. They put it in some medium. And what that machine does is it amplifies those particles. And so it can take very, very small amounts of that virus particles and be able to make sure and see if it's there in that sample. So it amplifies through many cycles, called cycle thresholds, we call it, to amplify that RNA virus. So as you can see with that, it's typically the most sensitive. So it's going to have the least amount of false negatives, and the specificity, which means when you get a positive, that you know it's a positive, is high as well. Both of those are in the high 90s. Now you'd say, well, why can't anything be 100%? And those that work in healthcare and or any type of lab environment know that none of our tests, whether it's a blood test or a throat swab for strep throats or a white blood cell count, they're not perfect tests, and we know that going into it. So none of our tests are really 100%. Even the chest X-ray or CAT scan, we just know that. And so I know that's a frustration sometimes on the public's part that, well, you can't say it's 100% negative or 100% positive. And that's just one of the inherent difficulties with any of these types of testing, because there's a lot of different pieces along the testing route that can cause, something to be negative falsely, more likely than false positive, including how they swab, how the specimen is collected, how it goes through the lab, all those things. The second type of genetic test that you see is called a Nat Test, or a nucleic amplification test. And that's a little bit different. We call it a pseudo PCR test because it also tests for that genetic material, the nucleic acids. That is what we see like in the Abbott rapid test. So when you see the nasal pharyngeal swab, that's a rapid test, Abbott test that some, I believe CVS do it. We do it at OhioHealth for our symptomatic folks. That's a 15-minute test. And it does a similar type of process, but because it's not amplifying to the degree of PCR test, it tends to not be as sensitive. Again, it's very specific. So if you're seeing a positive, you can feel pretty comfortable it's positive. But if it's negative, sometimes we do follow it up with a PCR if we feel that the diagnosis of COVID is likely. The second type of testing that we see out there, and you probably have seen, is the antigen testing. So it's a little bit different than the molecular testing in that it's really specific to the proteins, not the actual DNA or RNA material that's in the virus. So there's proteins on the outside, those attach to the cells in the nose and the oral pharynx, and gain entry into cells. And those proteins we can test for. Again, those are rapid tests. So it's a nasal test. You can swab, and then you get a result back in 15 minutes. And again, some of the CVSs are doing that. Now, the antigen testing, by nature of it being more the protein, it does have a lower sensitivity as well. So some reports are about mid 80s. So about 15% may be falsely negative when you get those tests. And again, those are tests that if we felt like the COVID virus was there or the person was suffering from that, we would likely retest with a PCR. Now the specificity is still pretty good. So again, along with the genetic testing, we don't typically retest those. And one of the challenges, and I get this question a lot, is, well, we got an antigen test or we got the rapid test that it was positive. So you talk about the governor. So, the antigen test or the Nat test, which is the other rapid test, is what they typically use like on the daily testing when the people visit the president, those kind of things, because it is quick. It's less expensive than the full in-lab PCR test. And so you see where those tests have been falsely positive. So like our governor went up, got a test, it was positive, but then he came back and the health system here in Columbus ran it twice on their PCR, and it was negative both times. So there is still a chance for some of those to be false positive, but for the most part, the specificity of them are very good. And that is considering they're symptomatic. So that's the other piece of this puzzle, and we'll show in a slide later that if you're symptomatic, it's a different scenario than if you're asymptomatic. because when you're asymptomatic, your viral load is typically very low. And so you're likely more to get false positives and false negatives in any of these tests. The third test that you probably have heard of is the antibody test. That is a blood draw. So we know that when you have COVID, most people develop some degree of antibodies, and you can test for those antibodies. There's different antibodies out there that can be formed because there's different parts of the virus that your body responds to. When you look at the proteins that I talked about earlier, your body responds to those proteins with antibodies so then it can fight it off. That's the goal. We have seen, on a side note, that when you have had COVID, the CDC just put out guidance, maybe about a month ago, that says for 90 days, when you've had a positive COVID test for about 90 days after that, the likelihood of you to get COVID again is very, very small, to the degree that if you're exposed to somebody with COVID during that 90 days, you don't need to be quarantined, because it's very, very unlikely that you would get that again. And if you have symptoms that may be likely a flu or something else, that we don't typically retest you at that point within that 90-day window. That will likely extend. And that's been the challenge with antibody testing, I think, from the beginning, is that we don't know fully what those antibodies mean. So if I go out today, get my antibody tested, and it's positive, what does that mean? Well, there's a few different possibilities. One is it could mean that I right now have COVID. And so typically if somebody has a positive antibody test, we should do a PCR test to say, okay, well, I don't have COVID right now. It's probably from an old infection. So that'd be the second scenario, that, yeah, I did have a COVID infection in the recent past, and now I have antibodies in there. The third possibility with some of these antibody tests is that some of these antibodies can cross-react. So we know coronavirus has been around since the 70s, at least, is when it was first detected. And, you know, it's from animals to humans. In this case, it was from bats, we believe. And so there are other coronaviruses that we've been exposed to. And typically, you think of SARS and MERS, those were both coronaviruses. And a lot of us had them and, you know, had a mild illness. So you can develop antibodies that can potentially cross-react and give you a false positive on the antibody. The other piece, too, antibody-wise, is they don't really form, we believe, until at least a month afterwards of having the infection. So really, when we look at the utilization of antibody testing, we found that the biggest use for it has been when you're looking at populations. And so if you're saying, well, we kind of want to see if this population has been exposed to coronavirus, they'll do some random sampling for antibodies. But for the day-to-day use, you know, and a lot of places offer it, and maybe some of you have had it, maybe it's reassuring to get it and show that it's positive, and say, well, yeah, I probably have had it, so I'm probably less likely to be infected with it here in the future. So I have to take, you know, less precautions and stuff. But we just don't know enough about how that antibody responds and if that actually gives us full protection for longer than 90 days. I can stop there. Is any questions on the testing types?
Only in that I've heard recently, like you were saying, that we don't know how long that protection lasts. I've heard something as much as maybe 4 months after infection that folks are now, there's evidence of reinfections.
Yeah, it's we know, like, even within a 90-day window, there was one person that they studied that was reinfected. Again, I think as time goes on, the longer this goes, we'll know more and more. And I'm sure there's always going to be people that don't produce antibodies when they get it, like their immune system is just not strong enough, and then they can get reinfected. So there's always that challenge. All right. So I wanted to show this slide just to kind of give you a visual representation and help maybe connect some of the dots of, you know, why testing is good and sometimes it's, you know, not as great, especially when we're talking about asymptomatic testing, because that's always the challenge. We get calls from different employers say, hey, can we just test everybody? We just want to get a good handle on things. And it's always like, well, what will you do with that data? How will that change things? And so when we look at this graph, we could tell, so the viral load on the left, goes up there, and then the time. So 0 days, 2 days, 4 days. So we're saying at 0 days, you were exposed to somebody with COVID. So you had an actual exposure. They coughed, sneezed, you inhaled it, you're in the same room, so you're going to get it, let's say. So we see then a graph, when you look at the line, which shows where that virus is, the levels of the virus go up. It doesn't really start until maybe day 2. And when you look at the different testings, so when you're exposed day 0, if you say, hey, I'm going to go out and get a test because I was exposed, really until day 3, 4, you're not going to have a positive test likely. So what does that mean? So we know that the CDC initially had said those that are exposed, we recommend, if possible, to get a test for COVID. Then they retracted that back in August 24th, which we're not really sure why, but then they actually retracted the retraction. So now they're again saying those are exposed. It can be helpful to get a test if you're asymptomatic, but it doesn't come out fully and say everybody should, right? And this is one of the inherent problems with it, because we know that if you get a test at day 0 for COVID when you're first exposed, or even day 1 or even day 2, you're likely not to be positive. And what does that do? It just gives you maybe a false reassurance. So when you look at that graph, okay, the PCR test, the IBID now, which was the other molecular test, the Nat Test, and an Antigen Test, it takes a few days really for it to show positive. And then you have this big box. So the virus is transmissible day 3 to day about 9 and a half as well. So then if you test for PCR, and we have another graph that shows the continued test, anywhere along that curve, even if you look where the PCR green dot is, if you go that to the right and you follow that curve down, you can continue to test positive 2 weeks, 3 weeks, 4 weeks down the road. So that's the other challenge with testing asymptomatic, is we don't know where on that curve they are, because they very well could be day, 3 weeks later and still be showing positive, because as your body fights off that virus, it breaks down the RNA virus into particles. Well, what do we test? We test those particles. So those particles can hang around for a while, even though you're not actually going to infect anybody else nor have any symptoms from that. Any questions on that? All right, and last thing I'm going to just briefly go through is when we look at the different buckets of who we test and why. So certainly symptomatic makes the most sense, right? So we know that people that are symptomatic, their viral load is typically high enough that they're going to show a positive on the COVID test. If assuming that's from COVID, right? So as flu season's coming into town, we know that can cause some more illnesses that are not COVID related. So if somebody's symptomatic, they get a COVID test, it's negative. The likelihood, again, that's a false negative is relatively small. Now, there are times where we've had symptomatic people that we've tested with a PCR test that's been negative, and then we test them 3 or 4 days later and it's positive. So we don't always say 100%, but that goes back to what the isolation rules are from CDC, which I'll go into here in a second. The exposed asymptomatic, kind of going back to that curve, we know that, there is that recommendation, if possible, to test exposed. In OhioHealth, for our own associates, we don't test our exposed associates. We know that the quarantine amount of 14 days is there regardless of whether they test positive or not. And in fact, I should say that a little differently. We know that if they test negative, that quarantine time of 14 days is still there regardless, because as you saw in that curve, it could be a false negative depending on where they are on that graph. If it's positive, then they switch over into that 10-day from date of test, or if they become symptomatic from the day of beginning of symptoms, and no fever for 24 hours, and symptoms are greatly reduced. So we don't overly test exposed as a general rule of thumb for the health system. with the amount of tests out there, the PCR tests have been probably the more bigger challenge, and because those take a lot of lab equipment, a lot of personnel. And so when you look across the nation, as these other more rapid tests have become, more and more, the PCR tests, which is kind of that gold standard, are the ones that, we're trying to grow, we're trying to add more, but those take the most labor and cost. Then purely asymptomatic. So asymptomatic screening, there are buckets, like we work with universities, obviously like football teams and other sports, they're testing asymptomatic. Now, again, the challenge is really to have a good asymptomatic testing plan, you really need to test like every day, because we know, again, looking at that curve, that you could test once and it'll be negative and test the next day and it'll be positive. So once testing becomes a lot more cost effective and available, being able to test people asymptomatically every day would be kind of that gold standard, but we just aren't there yet, except in certain communities and different sports, those kind of things. So yeah, so back to, the isolation again. So when somebody's positive for COVID, the CDC recommended guidelines, the health department will follow this. They'll actually give a legal isolation letter and a release as well. And that's backed by law, that, you isolate, which means, not around anybody. We use the term isolation, in case you're not aware, for anybody that's sick. So if you're sick and you need to go keep away from other people, that's considered isolation. Quarantine just means you're asymptomatic, you were exposed to something, and we have to wait for the time period to make sure you're not going to develop symptoms and infect other people. So just a little bit of a terminology difference. Isolation versus quarantine, there's not really much difference as far as what you do. You just have to stay away from people. So symptomatic, if you test positive, again, 10 days from the date of the beginning of symptoms, and then also no fever for 24 hours, and the symptoms have greatly reduced. They don't have to be all the way gone, but they have to be greatly reduced. And again, quarantine, 14 days from the date of exposure, because we know that you can show symptoms and be transmissible anytime during those 14 days. There's some literature that says even longer than that, 21 days, but the CDC was stayed at 14 days, because most of the evidence says within 14 days, most people will show symptoms. The average is about 3 to 5 days from exposure to show symptoms. Any questions on that slide? All right, with that, I will turn it back over to Dave.
Thanks, Dr. Williams. And really, we wanted to talk, and I've been on so many calls with Dr. Williams, and I feel like every time I hop on a call with him and an employer to talk COVID-19, I learn something new every single time. And I really appreciate his knowledge and expertise and making it so I can understand it every time we are meeting with an employer. And so just thanks for hopping on today and really talking through some of the details and the data there.
Sure.
In Marion, and it's really no different in Marion as it is in Central Ohio. I mean, OhioHealth is one of the larger employers within that community, and they had to do a lot to protect us as associates and to protect our communities. And sometimes that meant really being creative and retaining or repurposing associates in different roles that we work. So OhioHealth had a very large redeployment plan for non-RN positions to make sure that they could keep folks employed as long as possible. And they were able to do that. And as an associate of OhioHealth, just really appreciative of how creative our senior leadership was to keep us employed throughout the pandemic. And people were redeployed into all sorts of roles. And really at the very beginning in March, there was questions about, would you feel comfortable being redeployed? If so, here's the different areas. And we had folks working for environmental services. We had folks helping at testing locations. We had folks handing out computer IT equipment. I mean, really, there wasn't anything that OhioHealth didn't try to think of to keep people working. And of course, with surgery stopping, we had nurses working at testing locations. We had temperatures being taken across the system. And I think I have a video that I wanted to share about what we're doing at all our different locations to keep people safe. So I'm going to try to share my screen here, Dr. Williams. I'm going to take this from you. Let me know if you guys can all see this.
Looks like we can.
Yep.
Can you hear
At
it as well?
OhioHealth,
Yes.
we are taking great care to reduce the spread of infectious diseases like COVID-19 and keep our patients, providers, and associates safe. At all of our hospitals, physician offices, and outpatient care locations, you'll see safety measures like temperature and COVID-19 symptom screening at the entrances, patient care providers and associates wearing hospital-grade personal protective equipment, masks provided to all patients and visitors, routine cleaning of surfaces and medical equipment with hospital-grade disinfectants, signs and floor decals that promote adequate social distancing. We are working hard to put your safety first, but we need your help. Your cooperation with our safety procedures is one of the most important steps in creating a safe environment for all. OhioHealth providers are ready to deliver the care you need without compromising your sense of comfort. And thousands of our patients have had visits with their doctors using these new safety measures. That means the best time to call your doctor for care is right now. We will stay focused on your safety so you can stay focused on your health.
And so I think part of the reason I share that, and I was talking to Drew Dolmich, who's on the call with us. He's the senior advisor for business development for Marion. We were really talking about Marion specifically, Marion General Hospital and the Marion community. And if we go to the next slide, I'll talk through a little bit of the resources, but really wanted to talk for a moment about Marion General Hospital and that community. And I think in talking to Drew, although I know the community of Marion County is actually is close to going back towards that red in terms of COVID-19 cases, we're actually seeing inpatient admissions and ED visits down. And we have a couple of different hypotheses for that. And, part of it may be just comfortability of going back into healthcare facilities, right? And going into the ED for the care. But although the ED visits are down, we are seeing, like I said earlier, an increase in urgent care visits. And we have a tiered system for testing in our urgent cares and other facilities. And Dr. Williams, you could probably speak to this better than I can. Initially, when the pandemic started, we were really focused on testing first responders, our inpatient patients in the hospitals, and then our own associates. And as testing has become more available, I wouldn't say readily available, now we're into that tier where we can test those asymptomatic individuals. And I think we're seeing that in our urgent care in Marion, and then also in our urgent cares across the system where that testing is available through the urgent cares. But one of the, like I said, the hypothesis is that there's still that comfortability for the community about going into some of these facilities. And so we would still really be urging folks to talk with their primary care about, if you have symptoms, meeting with your primary care, discussing those symptoms. And then if the patient or person doesn't have a primary care in your facilities, really utilizing the urgent care in terms of getting in, seeing a provider at urgent care, and then discussing what their options are and what they think the provider should order. So a little bit about Marion specifically, and just kind of what we're seeing as far as, again, the decrease in inpatient admissions, the decrease in the ED visits right now, and kind of that natural migration to the outpatient, to the urgent care, and to our primary cares. And if folks aren't aware, and our division of Ohio Health Employer Services specifically, and this is something that Dr. Williams has worked a long time on putting together information to kind of send out to employers. So as we're kind of moving forward, if there's anything that employers need, or if they want to meet with me and Dr. Williams to kind of talk through resources, or if they want to hand some materials out, of course, please reach out after this. Matt's got my information that he can share through the chamber. But we are regularly sending information out, specifically right now about flu and COVID, what you can do in your facilities to kind of help with that, understanding why the flu vaccine is so important as we kind of enter flu season now. And we've been providing ongoing COVID-19 workplace information through our newsletters and videos, such as the one we just saw. So if you guys would like to be on that, you want to receive this information, please let me know, and I'll make sure that the emails get on that list. But we just want to make sure that we're providing information for best practices and continue to encourage associates to take care of their physical and mental health as we kind of move forward through this pandemic and navigate through flu season. I'll stop there. Is there any questions from anyone on the call, or Matt, do you have any questions?
Feel free if one of the manufacturers wants to jump on, but I had some that not necessarily COVID related, but just in general. Marion County was known as our general health outcomes were not great before a pandemic was entered into it. I think we were, I don't know, towards the bottom in the state. And I guess I just wanted to know has COVID made this year kind of almost lost in that sense in terms of trying to get forward momentum on some of that stuff, or have you found a way to still make that an emphasis with employers here in the area with their employees, or what's that look like, or has there been any substantial movement in a positive way on any of the outcomes that were kind of dragging us down, smoking or otherwise?
Yeah, and that was from the presentation that Dr. Gingrich gave last year for the folks that are in the meeting. Marion County did rank in one of the lower categories, or almost, I believe, the lowest of all the categories in terms of certain health outcomes. And I think, COVID-19 has highlighted some of that and has made it challenging. But from my perspective and from an employer perspective, I think we've continued some very positive conversations with our employer partners throughout Marion. And I think although we had to shift and pause some of those conversations initially to kind of let employers figure out what they had to do to kind of take care of their business, as businesses have started to open back up, I think those employers have reached back out and have continued to kind of want to push that needle to improve some of those health outcomes in Marion County. So I think really COVID-19 really only paused it momentarily and not necessarily stopped some of that momentum moving forward and trying to move the needle in a positive direction.
Are there any general tips or strategies you've seen and any of the, specifically in manufacturers, that you think would be beneficial for other manufacturers to hear? Things you've seen that are working in certain facilities, or?
Yeah, I would be interested if any of the manufacturers on the phone have any, tips or tricks that they've put into place in their facilities that they've seen that worked. I can tell you in my experience with some of the manufacturers that I've been on site with, simple little things like adding extra tables for breaks and for lunches so that people can continue to socially distance at work and not be sitting close to each other. Keeping distance between the different lines in manufacturing plants has been important so that, again, you can continue to social distance. And then just providing resources for mental and physical health, right? I mean, as people are isolated or quarantining, people are spending a lot more time alone. And so a real big focus on providing some resources for mental health has been really important and something that we've seen increase access to from our employer partners.
I have a question for Dr. Williams. As COVID-19 continues to be dealt with and the new flu virus becomes more prevalent, should people be using similar strategies to keep from getting sick, or are there new strategies that you'll be recommending?
It's a great question, and a couple pieces to that. I mean, certainly the flu vaccine, I think is, and especially this year, it is every year, but this year certainly very important for people to get. It's very safe. We believe it's relatively effective. The other piece, just to mention, is when they look at the Southern Hemisphere, which is where flu typically starts and worked its way here, it's been a very, very mild flu season there, which predicts it would be here as well. And certainly part of that has been all the social distancing, wearing masks, those kind of things. So to your question, it really is flu shot and then continue the other pieces, because, wearing a mask, washing hands, not touching face, distancing, staying home if you're sick, all those pieces are important really no matter what the illness, and especially with COVID and flu.
And there are lots of resources within Marion County in terms of flu vaccines between primary care, urgent cares in Marion, and then of course for our employer partners, you know, occupational health and the clinic there in the downtown space. There's lots of ways to get a flu vaccine this year. And I think just to reiterate what Dr. Williams said, it'll be as important as ever to really get that vaccine this year and make sure you're protecting yourself as best as you can.
And Dr. Williams briefly mentioned that the PCR testing eventually might be made more affordable, or do you have any thoughts on kind of when, what would drive that, or what, when would that be a possibility?
Well, I don't think the PCR per se, the one that's done in the hospital, which takes, you know, hospital lab equipment and a lot of time, those kind of things. I think that the cost of that will really be dictated by availability. I think what really will continue to drive down costs will be the rapid test. So the rapid antigen test, the rapid Abbott test. There's now a saliva test that you can do that some labs are running, where you just spit in a cup and it does a molecular test as well. All these tests, I think the more that companies are making them and making them available, it'll drive down those costs. And I don't honestly know what the cost currently is of like the antigen test, but I don't believe it's much more than $20, at some of these places. So, again, it's not, nobody wants to pay $20 once a day to get tested every day. But, ideally it would be like a urine pregnancy test where you could have, for $1, it would be done. So really I think it just, the cost of manufacturing, obviously the greater volume they have, the greater ability they are to make more and more will help drive down those costs. You would hope as time goes on, I think we have already seen it, that some of those costs have been reduced, but certainly not as fast as we'd like.
Does the Barks Road facility, is that just anybody can drive up, or do you need a doctor's request? Then I heard Center Street Clinic's going to start offering COVID testing. Is that true?
So the Barks Road location is the drive-through location, Dr. Williams. In Marion. All of our drive-through locations still require a provider
Correct.
order. I have not heard, Gus, about the Center Street Clinic, but I can touch base with our Work Health Clinic to see if Aaron Straw, who manages our Work Health Clinic there in Marion, has heard anything, or Drew, if you have heard anything about the Center Street Clinic. But then again, you have, of course, the Barks Road location, the drive-through, and then you also have urgent care now as an option for testing as well. So if the Center Street Clinic did offer testing, that would just provide another testing opportunity for the, community members in Marion, which is going to be a good thing.
Okay, yeah, I heard Sarah McNamee. I ran into her at the office on Friday. Now I may have mixed it up with the flu shot, so yeah, just so was it. I thought she said COVID testing, but then I also understand CVS does COVID testing now too.
Yeah,
they do. Mm-hmm.
Yep.
Excellent. Well, unless there's any other questions, Dave and Dr. Williams, thank you so much for presenting today and kind of giving us an overview of what's happening with OhioHealth and how it relates to manufacturers here in this area.